All day we're looking at how Brexit will affect health and the NHS, including the supply of vital medicines. Lots of people have been getting in touch to ask questions, and joining us now in the studio to hopefully answer them to everyone's satisfaction, Layla McCay, the National Health Services Confederation Director of International Relations, and Danny Mortimer, Co-Chairman of the Cavendish Coalition and Chief Executive of NHS Employers. Welcome to you both. Just a general question first. How much of your time is being spent thinking about contingencies for Brexit?
I certainly spend a very large chunk of my day, whether it's thinking about how we can make sure that we get a good deal for health for Brexit, or whether we're thinking about how can we make sure that the NHS is as prepared as possible for all eventualities.
Danny, are you equally occupied?
It's probably slightly more all-consuming for Layla, but it does take up a fair bit of time, and I think particularly over this last 12 months, as there's been quite a lot of work to do around the government's migration policy and how that impacts upon us post-Brexit, it's been really important.
Layla, first question to you from Cassandra FBPE on Twitter. Can type 1 diabetics be assured their insulin will be readily available?
I think this question of medicine supply is going to be one of the most noticeable impacts that we're all thinking about in health. And, you know, if the withdrawal agreement is to go through, then things will continue pretty much as usual. So yes, you would expect that supply to just continue as it currently does. In the event that the withdrawal agreement doesn't go through, then we find ourselves in all sorts of different scenarios, with the no deal scenario obviously being the most extreme end of that. And in that case, there will be probable interruptions to the supply of all sorts of different medicines. And that's because, you know, there'll be delays at the border, there might be regulatory differences that have to be introduced, all sorts of different things could happen. So the government is making sure that there's going to be this continuing supply through a variety of mechanisms. I think the one we hear most about is stockpiling. Obviously there's all sorts of different medicines that maybe can't be stockpiled, but the government is developing different ways of making sure they come in. And you know, a lot of that relies on industry being able to stockpile these medicines, and we hear that there are some challenges to that. But what I think is important to know is that we have worked with industry to make sure that these concerns have been fully understood by the government, and they are now coming up with further contingencies.
Danny, on staffing, from Simon Burgess in Cumbria, he emailed to ask, can we make departing NHS staff pay back their training costs?
I guess there's a couple of things there. I mean, I think the first is, I guess what lies behind the gentleman's question is, why is the NHS in this position? Why does it have such a demand for staff and we can't fill the vacancies within the country? Clearly we've got some challenges in terms of keeping people. We no longer pay for the training of nurses and other healthcare professions, and we only pay for a small element now of the medical school costs of doctors. So I think that's changed now in line with all university courses. But the simple fact is that our demand for people has grown quicker than we thought it would. And our demand for people has grown quicker than the plans of the government until recently in terms of investment in our services. So we've struggled to keep pace with actually the increase in emergency care that we've seen, the demand for our emergency services, which I think was touched on in Milton Keynes earlier today. We've struggled to keep pace with the fact that actually we're all living longer and we all need more care. And that's in part why we need to bring people in from outside the country, as well as try and keep the people we've got already.
Layla, Alejandra Solis asks, how will Brexit affect cancer drugs and investment into research?
So, I mean, in terms of cancer drugs, these are included in the stockpiling efforts and the other contingencies for things that can't be stockpiled. But I guess the wider question about research is how do we continue our place as a leader in life sciences research? And that's a commitment that we've heard from all players on all sides of the Brexit debate. And certainly there's a few different things. One is funding, and we know that in the first instance the government has guaranteed the research funding that currently comes from the EU up to the end of 2020. Another thing which is a bit more tricky is the research infrastructure. So if we're to continue to be involved in these big research collaborations that go across multiple countries in the EU and benefit our patients who get to have access to these new innovative treatments, then we need to be participating in that infrastructure. And if you're out, it's a bit more tricky. And I think the third thing is people. We need the best and brightest leading research, and certainly the UK has historically attracted those people, and we need to think about how we can keep doing that. It's more of a question of migration, not just of these researchers, but we also have to think about their family and making sure that they still continue to be attracted to the UK.
Danny, Leslie Snell asks, why are we not retaining enough of our home-trained staff? Because a lot of them do decide to go and live abroad, don't they?
Again, it's a really important question. There's a couple of things there. I mean, we do see particularly a number of our doctors in training choose to go and study abroad for a period of time and work abroad. Most return to the UK, like Dr. McCay here to my right did. But we benefit from that ultimately. Actually, doctors, other healthcare professionals going and working elsewhere in the world helps our services, and vice versa. We help other countries in terms of developing their people. Again, we return, and we are doing a huge amount more to try and attract more UK nationals in to work in the health service. The government are expanding medical school places in coming years. We're focusing a lot more on trying to improve the experience of our staff. The NHS has received a much more generous pay settlement in this year and the next 2 years than other public services. There's a lot happening to try and keep people here in our services. Again, though, we return to the point that Layla touched on in terms of researchers. We need a migration system. We need an approach to bringing people in from abroad, both in terms of researchers and clinicians and their families, but also the people who make up our teams in hospitals and social care, where actually we can supplement the UK workforce. And at the moment, I think the government are struggling to articulate a migration system that meets all the needs that we have in health and social care.
Layla, a question from Michelle Knox. She emailed to ask, why is the UK not manufacturing more medicines, making us less reliant on imports?
Well, the UK does already manufacture lots of medicines. We know that we receive 37 million patient packs of medicines in from the EU every month, but actually we're sending out 45 million patient packs of medicines. So we have a lot of manufacturing here. But I guess the thing is that over the decades of cooperation with the EU, all sorts of different manufacturing processes have been developed where as various medicines are manufactured, they go back and forward across the border lots of times. Like if you think of car manufacturing, that happens with car parts, back and forward, back and forward. The manufacturers find the best places to get various bits and pieces done. So I think that there's now this reliance on the ability to be able to cross back and forward across these borders, and that's actually where the challenge is coming in at the moment.
One final question for you both. It's a huge question and I need to ask you to answer it briefly, please. Jeff Warren asks, will the NHS survive Brexit?
If the government can agree a deal, and if we can put in place a set of systems that support migration and support our services, then yes, we can in terms of people, but it's a big set of ifs.
The NHS is used to challenges, it's used to dealing with emergency situations. What it really needs to deal with this challenge as well as possible is to be as prepared as possible. So if we can get some clarity in what's going to happen, if we can get some good operational advice based upon that, then the NHS should be fine.
Layla, McCay, the NHS Confederation Director of International Relations. That's a long name badge to have, isn't it? And Danny Mortimer, Chief Executive of NHS Employees. Thank